take even the smallest little concussions just as seriously as the big ones. It's kind of a shear stress on the nerves in the brain, or the neurons in the brain. So when you get hit, it kind of shakes the brain up. Yeah, any contact sport, but definitely football, girls soccer, takes a little longer for signals to travel, takes a little longer to get blood flow to the brain when you need it, and that results clinically in concussion symptoms that we see. You don't have to have loss of consciousness. Headache's one of our primary symptoms. Certainly confusion. So if an athlete's playing and they get a concussion, you'll see them, examples would be walk to the wrong sideline or not know where they are, or, so confusion. Vision changes, or maybe light hurts the eyes, noise hurts the head, nausea, lethargy, moodiness. The symptoms are wide-ranging. There is a set of symptoms that if you see them, that's an emergency room visit. So usually loss of consciousness, how long they should be out is kind of up to debate. I think any kind of loss of consciousness might ought to be seen at the ER. Headache that's just getting worse and worse and worse. A headache that's just kind of simmering is going to happen with a concussion, but if it's worsening, or if a patient starts vomiting, those would all be emergency situations. When your brain isn't functioning the way it used to, that affects you a couple different ways. One, everyday life is kind of hard to get through because it'll worsen symptoms. But the other thing is your brain's not going to react to an injury the way that it used to. It's going to potentially overreact, or could even swell, cause coma or death. And we call that second impact syndrome. That can happen even with a mild concussion. So we take concussion seriously no matter how robust the symptoms are or how few symptoms you have. Yeah, recovery time's definitely different. On average, children should take maybe about 2 weeks. Sometimes if recovery takes up to 4 weeks, that's not considered abnormal. And it just depends on the patient. A lot of evidence is starting to show that where we used to hold them out of school until they were feeling really good, we found that the patients we sent back to school sooner, even if you're just there and you're not able to participate in testing and stuff, the patients we sent back sooner got better faster. No concussion should go unseen by a physician for a couple of reasons. One, that's not safe, but for two, we need to safely get patients back to activity. And you can do that safest and fastest with guidance from a pediatrician or a family medicine doctor.